name is Linda Fleming McGee, and I am a reformed lawyer and clinical psychologist in private practice in Chevy Chase, Maryland. I treat adolescents, college students, and emerging adults. I write and speak nationally on young adult mental illness education and parenting challenges. But I'm here today representing the Steve Fund. The Steve Fund is the nation's only nonprofit organization focused on promoting the mental health and well-being of students of color. Our first speaker today will be Dr. Monica Webb. As the demand for counseling services on campuses continue to grow, so do new approaches to utilize other peer and faculty staff interventions to help stem the tide. Well-being coaches, otherwise known as wellness coaches, is being utilized on campuses as an emerging way to help identify and offer support to students that may not need counseling services on campus. This session will explore approaches to wellness coaching from the University of Florida. Please welcome Dr. Webb.
Good afternoon, everyone. I still see we're all awake now. That's good. That's comforting to hear. So as we've heard today, there is a national epidemic regarding mental health on our college campuses. And quite frankly, that's scary. It's terrifying to see these headlines out in the news. When that NPR article came out, lots of people were contacting me. Hey, did you see this? Did you know about this? Is that truly what's going on college campuses? Yes, it is. But at the same time, I have hope. I have hope because of that latest headline on August 12th, where college presidents are now starting to take more notice of these issues. I have hope because we've gotten together today to talk about innovative ways that we can address these issues on our campuses, ways we can scale up and scale down programs to make sure that we are targeting the needs of our own students. So one of the pieces I will share with you today is hope associated with a specific program that we have at UF. Now, your institution may be set up similarly, may not. There are many different models out there. Generally, or historically, I should say, mental health was considered the task of the counseling and psychology departments and centers. We know now that that is not the case. It's on all of us to do something about it. You see a lot of support from care teams or intervention specialists. You see a lot of support from medical services, recreation departments, and of course, health promotion. And so today, I wanted to go into wellness coaching, which is also known as well-being coaching or health coaching. Now, I do have to state a disclaimer. Originally, the title and the synopsis of this presentation was envisioned by Elise Phillips at Boston College, and unfortunately, she could not be here today. She has a fabulous well-being coaching program at Boston College. So she would be another wonderful resource to reach out to if this is of interest to you and your campus. So instead, they've asked me to come in and to speak about our own experiences at the University of Florida. And so coaching, wellness coaching, well-being coaching, health coaching, overarchingly is a way for an individual to see kind of the roadmap of their life, to be able to have the tools in front of them to make healthy choices, to be able to acquire skills that will help them balance out a holistic view of their life. Now you may be thinking, okay, that kind of sounds like counseling, right? And here's the thing, wellness coaching is vastly different from counseling. And this is why this is a wonderful solution on our campuses. We know our counseling centers, our psychiatry departments are overwhelmed by the amount of students. We are realizing, though, that a lot of students, when they get triaged in our counseling department, they're not rising to the clinical levels of treatment. And so to meet that gap, we've developed wellness coaching. Wellness coaching at UF has taken quite a long time to develop and to grow. We started out very small, to reach incredible numbers that we have today. And I'll talk a little bit about that. But it's important to note that we work very collaboratively with some of these other departments on campus, with the care team, with medical services, with the counseling center, to specifically talk about how we can provide support. Can we provide that continuum of care? And wellness coaching is not treatment. Wellness coaching focuses in on providing the tools. So if the student is considered the driver of their own vehicle, wellness coaching would involve the coach saying, let's talk about what's going on. What are some issues you're finding? And chances are, on your institutions, you're seeing the same sort of problems we're seeing. The top 4 impediments to academic success at the University of Florida are stress, anxiety, sleep, and depression. All of those impact mental health. They're all involved with mental health, correct? Chances are, if you're not getting a lot of sleep, it's impacting your mental health. You're getting more stressed out. What are some causes of not getting sleep? I know for one of them, looking at our phones constantly, time management. So when we start to break down the actual skills related to positive mental health, a lot of times they're associated with simple acts, simple behaviors. How do we have those conversations with students to focus in on that skill development? And so wellness coaching is more of a proactive solution. It's the ability for a student who may not be seen for treatment at a counseling center to come to our offices and still be supported, to meet one-on-one with a highly trained wellness coach and talk about a holistic view of their health. What are the things going on in their lives? What are their concerns? Our coaches do provide screeners. So if during the conversation and the sessions, there are situations that arise that we realize, okay, maybe this is a counseling issue, the student will work with the coach to fill out the screener, and the coach will work with the student to get the support within the Counseling and Wellness Center. So this service provides referrals to other campus services. It provides support in many different areas. It destigmatizes the issues, and it helps focus on actionable goals. That is ultimately the focus of these skills are the actionable goals. So when we think about wellness coaching, there's lots of different trainings, certifications, and I'll talk about a few of them out there. Ultimately, they're all based on some same theories and models. The stages of change model, trans-theoretical model. We know that an individual may not be ready for change, and that's okay. So part of this process within wellness coaching is first assessing the individual. Where is the student at? That is going to depend on the type of skills that are worked on with the student. There's also components of motivational interviewing within coaching. Using those questions for the student to self-reflect, to think about, okay, what is at the core of not being able to have enough hours of sleep? What is it really? Perhaps it's a conversation with their roommate. Perhaps it's learning how to time manage the schedule that they have, all the activities they're doing. So focusing in on those skills and focusing in on positive psychology. A strong component within wellness coaching is the thought that the individual is creative, resourceful, and whole. They have the ability to make the change. They have the ability to perform these goals. So how do we reframe things to get them to that point? Part of that is also self-determination theory, focusing on intrinsic and extrinsic motivation. And then, of course, we have growth mindset, resiliency. It's okay to not meet your goals. It's okay to fail. But then what are some techniques and some tools we can use in order to grow from that failure? So the process itself is pretty simple. Students come in, they're assessed on the stages of change. They look at their vision. They think about what they want to accomplish while they're a student at the University of Florida. Once they have their vision, then they're looking at specific focus areas. Is it time management? Is it social aspects, developing relationships? Is it perhaps stress relief? They don't know techniques for relieving that anxiety that they feel. Is it study skills? Is it healthy eating, physical activity? So taking a holistic view of the student and figuring out what are the key focus areas that they want to focus on, that they want to use to develop the goals. Then they work with the coach to develop the goals and the skills, generally starting out with one actionable goal. Sometimes it's two, but focusing on small steps. The coach establishes accountability, provides that support, and they also work together to track and evaluate progress. And that could be many different ways. It could be following up with their coach via email. Could be taking a picture of themselves working on one of these techniques. Whatever works best for the individual student. And then along the way, as they continue to meet with their coach, it's also talking about what are the barriers, what were some problems they ran into, how do you problem solve from there, how do you develop the solutions. So again, it's very centered on the individual. Now, at the University of Florida, we always focus in on what is going on with everyone else. Benchmarking is key to everything we do. And so about a year and a half ago, we started benchmarking with other institutions. We wanted to see how we could grow our coaching program, how are things being done elsewhere, what are some successes, what are some failures, how can we grow and change ourselves. So about 30 institutions were contacted. Wellness coaching, well-being coaching, health coaching programs are in all different types of areas in the institution. Sometimes it's a shared model where it may be 2 departments working together, 3 departments working together. They vary in the cost to students. Some are free, some have a fee associated with them. Some of them are a hybrid model where after X number of sessions, then a fee is incurred. The coaching models also vary themselves based upon the resources of the institution. It could be a pro staff model, it could be a peer staff model, or a combination of the two. There's also various different kinds of trainings out there. ICF is generally the largest one that's associated with wellness coaching, and I'll talk about that a little bit more in a minute. There's also other certifying bodies out there that provide certifications and trainings. And then we found a whole host of different homegrown or smaller institutional training programs that have been developed primarily from the peer coaching aspect. When we're thinking about wellness coaching specifically in higher ed, it's important to consider certain aspects of the models and the certifications. A lot of times you'll see this coaching within worksite wellness, within hospitals, within many other different aspects, but we know higher ed is a different kind of community, right? So what we found is that it's important to be mindful of the code of ethics as well as standards and competencies of various organizations. So the International Coaching Federation, which is one of the leading certifying bodies, the National Board for Health and Wellness Coaching is another really top-notch certifying body. And these two have very clear code of ethics, which is important because on college campuses, it's real easy to get burned out. We all know that. It's real easy if you have peer programs for the peer to get really involved in what's going on. And so as a coach, how do you provide that balance? How do you provide that emotional detachment so that you're also practicing self-care yourself? Then there's also the ACHA standards of practice for health promotion, which are very applicable to wellness coaching. And in fact, I'm gonna do a short plug because they are currently being updated. And so we're gonna have, hopefully very soon, a new set of standards for health promotion coming out. But there are many different ways of getting to that endpoint of providing the training for developing these sorts of programs. Now at GatorWell, we are very fortunate. We are a long-standing department. We've been around for quite a while. We have a fabulous marketing team, and this is one of the many ways that we demonstrate the image of what wellness coaching is. This is an image from one of our postcards. We developed postcards for students with various institutional landmarks, and on the back it's written like a card to the student. Hey, we're thinking about you. We know these things are hard. Come check out wellness coaching. We can talk about time management, stress, healthy eating, developing social connections, and really making that more approachable in terms of the marketing. Now, our program started out very small. 2010, we were piloted, 1 coach, 79 students. We have grown this past year. We have had 775 appointments. Initial appointments are 1.5 hours. Follow-up appointments are 1 hour. So at the bare minimum, we're saving 775 clinical mental health hours from the Counseling and Wellness Center. So what are some of the actual behaviors that are being looked at? The action plans vary, and it might vary from session to session depending on how the individual is working through the behavior change. Time management is by far the top thing our students work on, followed by stress management, sleep habits, test taking and study skills. They can talk about anything and everything with their coaches, and their coach will help refer them to campus resources, to other areas where they could provide additional support. We also assess behavior change. Remember, we're tracking stages of change. We've got pre-assessments and post-assessments. And what we're initially finding is there are changes in behavior. We're looking at after the second appointment, when the student has had time to work on developing that behavior change, they're working on their relationships. They're identifying their social support, which we know this generation is the loneliest generation to date. How awesome is that? They're coming to talk to a coach and learning about their support system around them. They're also counter-conditioning. They're substituting healthier behaviors for the unhealthy ones. They're learning new facts, new ideas. They're raising their consciousness. So we're seeing some fabulous impacts with this program. In fact, we're seeing impacts on GPA. And this is really exciting stuff we're starting to dive into. Statistically significant impacts on a student's GPA. Having 1 appointment is not going to change a behavior. But if a student arrives for an initial, comes back 2 or 3 weeks later after they've had time to work on a behavior, they can revisit that with the coach, talk about successes, talk about failures, tweak that goal, that plan, and keep working on that behavior. And we're seeing the impact on their academics. Now, as our program has grown, we have heard from students the fabulous impact this is having on them. At the same time, we all know as programs scale up, we need to have considerations. So recently, we limited the number of sessions to 4 sessions a semester. But that's also with the consideration that it takes at least 2 weeks to work on behavior change. So far, we haven't turned any students away. The coaches have the ability to come together as a team to talk about the cases they have and to decide, is the student going to benefit from additional sessions? And remember, that limit is just per semester. We also offer group coaching. A benefit of group coaching is the development of accountability buddies. Group coaching, they get paired up with a peer, and they've actually developed lasting friendships from that. Again, loneliest generation to date. So even if a student isn't able to be seen for wellness coaching, we try to provide those skills in other aspects. Perhaps it's a goal-setting workshop. Perhaps it's a time management workshop using some of those skills, but at the end of the semester when they're really stressed out about their exams and their grades, Is that the optimum time to start wellness coaching? No, but we could still work on some of those behavior change aspects. So I invite you all to think about it. Perhaps this is a tool for hope at your institution. Perhaps this is a program that you can start out small, and that's okay. Based upon resources that you have available, really cater it to the students and the needs that they have. And I'd like to thank my fabulous team. We have wonderful professional staff as well as grad students who work hard to collect this data as well as actually go out there and provide the wellness coaching for students. And that is a testament to the quotes you saw throughout this presentation. Thank you.
So, Monica, there's a ton of questions, but I'll give you a couple of them, and later on maybe we can do the rest of them in writing, and we'll share them out with them online.
Okay.
The first one is, what credentialing process pertains to wellness coaching to ensure competency in delivering the service? Peer review, question mark. What are the AAHC standards?
I'm not sure about that last component of the question. There are various different certifying bodies, and they have different requirements and expectations. So I would say it really depends on the resources of the institution. At GatorWell, we do Real Balance, and that just happened to be the program that was picked from the very beginning. However, we understand there are barriers such as cost, so perhaps it's looking at one of the other certifying programs that are out there.
I know this other question is a big one, but how do you assess the impact that wellness coaching has on utilization of counseling services?
So looking at hours saved is one way that specifically our health promotion office tries to justify that. Looking at the referral aspects as well. So how many students are being sent over from the counseling and wellness center? How many students are we also then sending over there? Looking at those relationships. We have also recently applied Maxient as a case management platform within the Division of Student Affairs. And that platform is being used with wellness coaching within our health promotion office, as well as conduct, as well as housing conduct, our care team. And so that will be improving how we communicate. Counseling Center obviously uses titanium, as many of us do, so perhaps it's more of an aspect of a read-only access to Maxient, and that's the part that we're exploring right now. But being able to increase those lines of communication and show the impact of the behavior change of the actual coaching, as well as how much time and effort is being then moved to a different department to free up actual treatment, is where we've found our greatest successes.
Thank you very much, Monica.